It's powerful stuff, and it's consistent, it's reproducible. That's why I like it. I don't want to just put something out there and not be good for everyone. So
I felt so good. And I think for in the Midwest, it's dark and it just really helps with that mood enhancement. So that's just another hidden benefit. Hi, I'm Dr. Robin Ackerman with Balance Family Chiropractic in Bartlett. I'm here with Dr. Neil, who's the CEO of Renu, and we're super excited. He's going to tell us more about the Light Pod. Thanks for joining us today.
thank you, Dr. Robin. I'm happy to be here. And first, I just want to congratulate you on investing in the very best technology for your patients in your community. I'm so excited to talk about it today. So
we're very excited, and the patients are too. So we have just some things we are wondering, and we're excited. But tell me a little bit about what makes this bed different than some of the other things people might see online.
That's a great question. I get that quite a bit, as you can imagine. So there's two different grades of Redlight equipment. So one is a consumer grade, right? That's something you can buy on Amazon, or you can go to Walmart, you can buy it on TV, and and those are fine. But the main difference is they're not high powered, so they're not clinical strength, right? Or medical grade, I should say. So unless you have about an hour a day every day to spend in front of that home unit, getting a long-term outcome. Now, I take it like vitamins. Something is better than nothing. So if you're not doing anything at all, then yes, use a consumer grade light. But Renu Light is clinical grade. So it's powerful. It's strong. Most of your patients only need 12, 15-minute sessions at a time. And then it gives you the right dose of light energy, and it builds in your system. And so that's what's so great about a clinical grade bed. Does that make sense? There's also 4 different bio-optimized wavelengths. So 2 red, which is why it's called Redlight, and then 2 infrared. And so those go deeper in. The consumer grade lights may have 1 red and 1 infrared, but they're not powerful enough to really penetrate.
And there's so many benefits we keep hearing about, but tell me a little bit, how exactly does it work?
Give you a little background. I used to be a biochemist for a pharmaceutical company, so I'm a Krebs cycle nerd. So I love, everyone remembers a Krebs cycle in high school biology. So, and that's where this begins. So your cells inside respond to, they have these things called chromophores. So chromo means color, right? So they have these components, these molecules called chromophores, and particular wavelengths will stimulate them. And so that's from about 600s, which is red light, all the way down to 1,000 nanometers. So your light, the light that you had got, you have in your office, goes from 630 to 940. So it's pretty much optimized in that optical range. Okay. This light goes in, stimulates those chromophores, will open the cell walls, and then will signal to the mitochondria and stimulate it to produce more, something called ATP. Do you remember that?
Yep, energy.
It's energy. It's the body's currency. And the trouble is, most people, all of us included, are running around not being optimal. So our cells aren't producing enough energy for us, maybe just enough to get through the day. But we don't have enough ATP or currency in the body to stimulate a good optimized healing process. So we cannot function properly. And so all we're doing is just getting ourselves sicker and sicker and sicker and sicker. Does that make sense?
Yeah, that does. And we're seeing it a lot, like the level of inflammation in people and pain, and it's really high.
It's amazing. So all the things that this it's called photobiomodulation, by the way, if you want to really get nerdy about it. But it's a energy medicine, and it's in something called longevity medicine. So we always look at, okay, how do we? I used to open up seminars and we used to say, how do we live younger and stronger for longer? People, as we're aging, we want to live well. We want to still be able to do things. We want to be mobile. We want to heal. We don't want to get sick all the time. And we have a brush fire. I call it a California brush fire. I know you're in Chicago, so that's you never see that. But
we're just frozen here. Everybody's frozen here, and so it's okay.
But it's meaning that there's inflammation riddled all over the body, and this is why COVID had such a field day. It didn't matter if you were overweight, didn't matter if you were in shape, it didn't matter if you had diabetes or some things aggravated it and attracted it, but the immune system was so busy putting out all these fires all over your body that there wasn't enough left to take care of it. Does that make sense?
Yeah, that does.
What it does is it bathes the entire body in 360 degrees of this light, these 4 frequencies. And what I love hearing about it is, and I think you and your staff have tried your bed, and you can talk to us about how you feel after you get done.
But yeah.
I love hearing patient responses. I love seeing testimonials and getting videos and seeing them go, wow, I feel different. And that's only after a few visits. It is it's amazing to see them go through an entire journey and improve their health that way.
Yeah, and I mean, I could tell you all of our staff have tried it since we've gotten it, and we're moving from the pads to the bed. The bed is 10 times more than we thought it could be.
Yeah.
I walked out of there and I went outside for lunch, and I told my staff I could breathe better. I'm like, what is this? What is this bed about? Because I felt so good. And I think we're in the Midwest, it's dark, and it just really helps with that mood enhancement. So that's just another hidden benefit.
And just to give patients an idea of how important light is to our bodies. So, we're in a vitamin D deficiency chronically in this country. Greatest country on the planet, and we're all running around vitamin D deficient. That's because we're not getting enough exposure to our bodies and our skin. Not only that, sun has UV rays, right? So it's got some harmful rays in there too, so you want to limit that. But there is no after effects except for feeling better of using this bed. So we just use the 4 safe biooptimal wavelengths, and we give the body what it needs. So take, for example, your liver. So what happens with a baby when they get jaundiced? They've been using light therapy for decades, since I was born. And I'm not going to tell you how old I am. But and so that tells you how responsive our bodies are to light. So same thing with D3. Our livers may be toxic, they may be sick, they need stimulation, they need this light, they need an anti-inflammatory program, which we also created to go with this. It's just incredible. I just finished a webinar on synergistic effects of light therapy and nutrition. It's all in the inside out,
Wow.
So it's fantastic.
Amazing. And, being a family office, we see all different ages in our office, from teenagers with athletic injuries to seniors that are trying to play pickleball and chase their grandkids around. What would you say are the type of conditions that we might be able to help with?
It's easier to say what conditions you shouldn't treat with this light rather than what you should, because this is a whole body systemic therapy. It really doesn't discriminate on condition. Does that make sense? Now, for example, you can see, so in my practice, I used to, if they had back pain, any sort of pain, because pain causes inflammation, or vice versa, inflammation can cause pain. So I would put them on this. I had neuropathy patients, I would put on this. Diabetics, I would put on this. And there's so many other, I have a doctor couple in Nashville, and they were talking to me, and they said, hey, we see a lot of Lyme's disease. Well, I've only seen maybe 2 Lyme's patients in my whole career. So I was like, wow, that's pretty rare. And, we developed a Lyme protocol, because this thing, it's easier to say what it can't help than what it can help. It's amazing. Mental health issues, anxiety, depression, traumatic brain injuries. Like I said, orthopedics is a given, right? You can even do aesthetics. Isn't that cool?
That's what I was going to say. Like, tell me more about like the skin. We all want to look younger. We all want to feel better. And the weight loss. That's a huge one. How does that work with weight loss?
So there's a whole contouring program we built before the technology was there for this other stuff. And then just a few years ago, we put in the other technology. But this produces and stimulates collagen production. So collagen are these proteins in an infrastructure to your skin. So it plumps your skin, it creates more circulation, it tightens it. Cellulite, for example, it's great for cellulite. It's great for wrinkles, crow's feet, all that stuff. And even skin conditions, right? Acne, psoriasis, eczema. The only thing that I would say, well, like I said, there's a handful of contraindications, but you and I can talk about that another time. But people, and then the 60-day program that we developed. Okay, so patients were coming in. I was trying everything under the sun at the time. Grocery bag full of supplements, restrictive diets, 500-calorie diets, all those things, and it was just too hard. I didn't want to do something that would hurt my patient in the long run. So I just kind of said, there's got to be a better mousetrap here. And so I started formulating these drops. So we have 3 formulas we put under the tongue. And the reason why is because that's the second best way to get it into your body other than straight IV or injection. So now they can do this at home. They don't need an injection or an infusion, which is, so we have an amino acid complex that we use, okay? We have a raspberry ketone, which is an exogenous kind of fuel for the brain. It's very clean, gets rid of brain fog, mental clarity, all those things. And then the third formula is a B complex. So most people are familiar. They go to their doctor and get a B12 injection when they're trying to lose weight. And this is the whole complex, and it mobilizes fat, so it helps fat metabolism, and it gives them energy while they're on the program. It's non-starvation, and we have a QR code for patients. It's a video walkthrough of it, so they don't. 99% of their questions are answered basically in that kit that they get. So we wanted to make it as easy for everyone as possible. And then all you guys get to do is see the results as they come in for their treatment.
That's great. Like, the drops have been amazing. People love it. They're easy. We're excited to add the bed. We've had a lot of our patients, even teenagers with a lot of athletic injuries. Would you say a teenager would do well with something like this?
Yeah, we've actually, I get a lot of doctors calling me, asking me about pediatrics and younger kids, and you just have to lower the time on for a minor. So.
Okay, that's great. And tell me more. I know some people wear eye goggles, some people don't. In our office, we have people wear either shorts and a tank top or a bathing suit. What would people expect when they come in?
Yeah, we just coach the patient, let them know gym clothes, something loose. Ladies can wear either bra and underwear, or they can wear a swimsuit if they want. The more skin exposure, the better. Men, shorts is fine. And then, like I said, like a halter top, like a sports bra, and some shorts, spandex shorts or something. They don't have to leave the room. They can get undressed, get into those things, get in the bed, get maximum exposure, and then they can get dressed and leave. It's pretty automated. They can turn the machine on their own when they're ready. So we tried to make it as easy as possible for everyone. So.
And how long does it take to see results?
Well, every body is different, but we hear when you're doing something that's measurable, like contouring, so you'll do measurements beforehand, you'll see inch loss after the first treatment. and that's measurable. So we've done that time and time again. That's how powerful the light is. Now, something else, somebody may take them 2 treatments. Now, I've seen data where after 6 visits, a neuropathy patient will notice more sensitive feeling in their hands and feet. After 12, 98% of patients will recognize the difference. So, it's powerful stuff, and it's consistent, it's reproducible. That's why I like it. I don't want to just put something out there and not be good for everyone. So,
right. And, I mean, you've used this for quite a while. How long have you been using Redlight?
Since 2015.
Wow. So you've definitely seen some. I mean, it's everywhere now. I feel like you open any online forum and it's Redlight everywhere.
Well, what's interesting is that it's kind of, the technology really wasn't there 10 years ago. It is now. And then it's in the conversation. And you're right, Dr. Robin. Everyone wants, they're looking for it and they want it. And it's incredible. Like I said, longevity medicine. Everyone wants to be younger and stronger for longer. I like telling people I'm really 95. So,
yeah, why not?
I do that in seminars sometimes, but I mean,
one of the things I noticed is when I was looking into Redlight, I like to read all the research studies, and sometimes you read online and you read positive and negatives, and honestly, I read so many good articles and research studies in like almost every medical journal that you see, it's good results.
Oh yeah, I've got plenty of National Institutes of Health papers and PubMed. The thing about negative is that they need to know how to use the equipment properly, because there's something called overexposure. So, you don't want to give too much, because you are giving them a dose and it does get in the tissues. It won't hurt, but sometimes it can have the opposite effect. So that's why we have specific protocols we use with our owners, and we make sure that they're treating appropriately. So versus just giving them a piece of equipment and saying, "Hey, good luck, have fun."
Which makes sense to have it, more in a medical environment or a healthcare environment where we could really target that patient in a positive way, safe, effective. And that's why I also like this unit, is that FDA clearance is really important to people. Tell me about, does this bed different than someone else that maybe has it at a gym or somewhere else they might see around town?
So I would say that if it's sold to gyms and the general public, it's might be cleared, maybe. We don't know where they got it from. So you're kind of taking a chance, and I don't know what's in any of these gyms. I don't know how powerful they are. I don't know if, and if they are powerful enough, I really worry about overuse, because a lot of those gyms just charge you a monthly membership and you come use the thing as much as you want. And you don't want that out of a medically strong medical grade bed. You just don't, because you're going to have an opposite effect. You're going to actually increase inflammation and get sicker. And so that's why it should be supervised, at least at this level. Now, if you have something at home, you can sit in front of it. It's not going to be powerful enough to do much for you.
Now, I've also read a little bit about some of the studies with MS and Parkinson's. Are there any current things that are being really found, that they've found some unique benefits of red light therapy?
So I love the questions you're asking, but so as far as clinical trials, it's hard because this isn't a treatment that's funded by a pharmaceutical company, because clinical trials is a very lengthy process. We have data, and we have anecdotal data from all the patients across the country, all the providers. So we know that the bed is clinically sound. We know it works. There are some small studies out there. There's studies in Europe about eyes. And I didn't answer that question. So sorry about that. So what I do is I do use the goggles because you're going to get a whole systemic treatment and it's going to go to your eyes. So versus them, I just don't want anyone staring at the light too long and thinking it's okay. And so I'd rather err on the side of caution and say, hey, use it for your eyes. And you see this, it's a very, very strong, powerful light. And so I just send goggles with them, but little tanning bed goggles, nothing big. They can put them on after they get in the bed because it's not going to hurt to look at it for a second or two. It just won't.
Yeah,
I
it's
personally,
definitely relaxing.
yeah, I personally prefer patients put the goggles on. So.
Okay, and then after they're done with a session, I know some people will stand on a vibration plate. What is the purpose of the vibration plate?
Yeah, great question. So vibration therapy accomplishes a lot of different things, but one thing it does is 10 minutes equates to about 30 minutes of walking exercise, right? So it speeds that up. So we always tell the patient, get on that after, because what we're doing is we're getting rid of free radicals and toxins and all that. It's going to go into your lymph system, so your lymphatic system. And so that drains through your kidneys and through the liver. So we have them, number one, drink plenty of water, and then we want them to do some sort of exercise after. Well, 10 minutes beats 30 minutes. So we get them on. Now, for the patients that can't do the vibe therapy, you might have somebody with hardware in their back or acute back pain, and that would irritate them. We just tell them to go for a walk after in place. And then when they get to a point where they're feeling better again, which they will with the light and your treatments, the other treatments you offer in your office, which, by the way, I commend you because you're offering just the best.
We're trying to really change the healthcare of our area, and it's pretty great. The neuropathy and shock waves and decompression we've added has been amazing.
Yeah, I did all those things and loved them. I just love what it did for the patient, and that's what I did. I also added this in because I was like, whatever we're doing to it, I want to improve the outcome.
Right.
I want to enhance their healing ability even more. So that's why I did that. But
right.
Yeah.
And what would you say to somebody that's skeptical about red light therapy?
It's okay to be skeptical, just not cynical. So I'd say come in and try it.
Yeah.
Try
that makes sense. I mean,
know,
that's why we're doing this.
There's a lot of bull out there. I'm not gonna
right.
There's fluff and BS and I would offer or invite anyone to come in and try the therapy and dare them not to tell me that they're not feeling better or feel a difference. I really do. I'm that passionate about this. It's science backed. It's not anything. It's not opinion at this point. And I would tell somebody who is skeptical, I'm like, there's data. This is science backed. Or find a friend of theirs, take care of them, and then they can brag about how good they're feeling too.
That's true. We've seen that before, that's for sure. Yeah, and I would say regenerative medicine, like red light therapy, all the things we could do to improve our function in life, because we are probably going to live longer. How can we change so that we live a quality of life? I feel like it's like the future of medicine right now.
Yeah, it's here. It's not the future anymore. I used to say that too. I'd be like, the future of medicine is here. And
yeah, we're getting there. It's amazing.
We're so lucky that we have it available. But another good published paper was osteoporosis. It improves and increases bone mineralization.
Wow.
It's been phenomenal. You do that on an osteoporotic patient, and then you get them on the vibe, which produces the Wolff's Law, which is force on the bone, which will force the body to produce fortified bone, so it'll mineralize more. So
that's amazing. I mean, that is something that we see all the time in our office is osteoporosis. But I really thank you for creating this, for your time. Our patients that are on here today, I want to invite you guys to come in for a mapping session. February 6th, we are going to open this up to the general public, and I know we're going to be busy, especially with the neuropathy cases and some of the other things we're doing. So from now until then, we are going to open this up for a mapping session. It's normally $150 once we open it up to the public, but we are offering that for free to our current patients. It's a 15-minute session to meet with us to map out how you're doing, your goals, and to create a Redlight plan with you to see how we can help you. So I would move fast on that. Reply to this message. You could put your first and last name and any family member or friend you'd like to bring with you. We're including it for them. And we can get you feeling so much better.
Oh, that's great.
Thank you so much, Dr. Neal.
Thank you, Dr. Robin. I appreciate it.
Have a great week.
Yeah, have a great happy holidays and New Year.
Yes, you too.